Vitamin D, often referred to as the sunshine vitamin, is crucial for maintaining overall health. Unlike other vitamins, vitamin D can be synthesized by our bodies upon exposure to sunlight. Vitamin D isn't a single entity, but a group of compounds, the most important being vitamin D2 and D3. Vitamin D3 is produced in the skin when exposed to UVB radiation from sunlight and is found in animal-based foods. Vitamin D2 is found in plant-based foods and supplements. Both forms contribute to maintaining adequate vitamin D levels, but D3 is generally more effective. The body converts both forms into the active form, calcitriol, which carries out various functions. It plays a critical role in calcium absorption, bone health, immune function, and cell growth. Maintaining adequate vitamin D levels is essential throughout life to support healthy growth and prevent chronic diseases. In the following sections, we will explore the fascinating role of vitamin D in the body and the consequences of its deficiency. Vitamin D's primary function is to regulate calcium absorption in the gut, crucial for bone health. Without sufficient vitamin D, the body cannot effectively absorb calcium, leading to weakened bones and an increased risk of fractures. Beyond bone health, vitamin D plays a vital role in immune function, enhancing the ability to fight off infections and reducing the risk of autoimmune diseases. Studies show that adequate vitamin D levels can protect against respiratory infections. It also contributes to a healthy inflammatory response. Vitamin D influences cell growth and differentiation, reducing the risk of certain cancers. Research continues to explore vitamin D's potential in cancer prevention and treatment. Emerging evidence suggests vitamin D may also benefit muscle function, nerve health, and cardiovascular health. Maintaining adequate vitamin D levels is increasingly recognized as a cornerstone of overall health. The primary source of vitamin D is sunlight. When our skin is exposed to UVB radiation from the sun, it synthesizes vitamin D3. The amount produced depends on factors like time of day, season, latitude, skin pigmentation, and age. During summer, shorter sun exposure suffices, but in winter, especially in higher latitudes, sunlight is often insufficient. People with darker skin require longer sun exposure to produce the same amount of vitamin D. Dietary sources of vitamin D are limited, with fatty fish, egg yolks, fortified milk, and cereals being good sources. It can be challenging to obtain sufficient vitamin D from diet alone, especially for those with limited access to these foods. Supplementation is often recommended for individuals at risk of deficiency, including those with limited sun exposure and older adults. Vitamin D supplements are available in two forms, D2 and D3, with D3 being more effective. Ensuring adequate vitamin D intake through sun exposure, diet, and supplementation is essential. Vitamin D deficiency can manifest in various ways, and some individuals may experience no noticeable symptoms. Prolonged deficiency can lead to health problems like bone pain and muscle weakness. In children, severe deficiency can cause rickets, characterized by soft, weakened bones. In adults, it can lead to osteomalacia, increasing the risk of fractures. Fatigue and tiredness are common symptoms, ranging from mild to extreme exhaustion. Increased susceptibility to infections is another sign, as vitamin D plays a crucial role in immune function. A deficiency can weaken the immune system, making individuals more vulnerable to infections. Recognizing these signs is crucial for early diagnosis and intervention. Diagnosing vitamin D deficiency involves a simple blood test measuring 25-hydroxyvitamin D levels. This test is the most accurate way to determine vitamin D status. A doctor can order the test, typically performed in a laboratory. Results indicate whether an individual has sufficient, insufficient, or deficient levels of vitamin D. Optimal levels are generally above 30 nanograms per milliliter. Levels between 20 and 30 are considered insufficient, while below 20 are deficient. Factors like age, season, latitude, skin pigmentation, and dietary intake influence vitamin D levels. Individuals with limited sun exposure, darker skin, and older adults are at higher risk. Certain medical conditions can also interfere with vitamin D absorption. If diagnosed, treatment typically involves vitamin D supplementation. Treating vitamin D deficiency involves increasing intake through supplementation. Vitamin D supplements are available in two forms, D2 and D3, with D3 being more effective. The dosage and duration depend on the severity of the deficiency and overall health. For mild to moderate deficiencies, oral supplements are recommended. These are available in various forms, including tablets, capsules, and liquids. Regular monitoring of vitamin D levels through blood tests ensures treatment effectiveness. For severe deficiencies, higher doses may be required, sometimes administered through injections. Increasing dietary intake of vitamin D-rich foods can also be beneficial. Fatty fish, egg yolks, fortified milk, and cereals are good sources. Incorporating these foods into the diet helps maintain adequate vitamin D levels. Vitamin D is crucial for maintaining strong and healthy bones. It is essential for calcium absorption, necessary for building and maintaining bone density. Without sufficient vitamin D, the body cannot effectively absorb calcium, leading to weakened bones. In children, severe deficiency can cause rickets, resulting in bowed legs and bone pain. In adults, it can lead to osteomalacia, causing bone pain and muscle weakness. Maintaining adequate vitamin D levels throughout life prevents bone loss and reduces fracture risk. This is particularly important for older adults, as bone density naturally declines with age. Ensuring sufficient vitamin D intake supports bone health and prevents osteoporosis. Vitamin D plays a vital role in regulating the immune system. It enhances the immune system's ability to fight off infections and reduces the risk of autoimmune diseases. Studies show that adequate vitamin D levels can protect against respiratory infections. Vitamin D receptors on immune cells indicate a direct interaction with the immune system. It helps modulate the immune response, preventing overactivation and reducing inflammation. Research suggests that deficiency may increase the risk of autoimmune diseases. Maintaining adequate vitamin D levels may help prevent these conditions. Further research is needed to fully understand the relationship between vitamin D and autoimmune diseases. Emerging evidence suggests a link between vitamin D levels and mental health. Studies show an association between deficiency and an increased risk of depression and anxiety. Vitamin D may play a role in regulating neurotransmitters involved in mood regulation. Low levels have been observed in individuals with mood disorders. Some studies show that supplementation can improve mood in deficient individuals. Vitamin D receptors in the brain suggest a direct role in brain health. Maintaining adequate levels may support mental well-being and prevent mood disorders. Ensuring sufficient intake through sun exposure, diet, and supplementation may be beneficial. Beyond its roles in bone health, immune function, and mental health, vitamin D may have other benefits. Emerging research suggests a role in cardiovascular health, muscle function, and reducing inflammation. Some studies show an association between higher levels and a reduced risk of cardiovascular disease. Vitamin D may help regulate blood pressure and improve endothelial function. It may also play a role in muscle function, with deficiency linked to muscle weakness. Supplementation may improve muscle function in deficient individuals. Vitamin D's anti-inflammatory properties may help reduce chronic inflammation. Maintaining adequate levels may protect against chronic diseases like heart disease, diabetes, and cancer. Maintaining adequate vitamin D levels is essential for overall health. Vitamin D plays a crucial role in numerous physiological processes, including calcium absorption and immune function. Ensuring sufficient intake through sun exposure, diet, and supplementation is crucial for preventing deficiency. Regular sun exposure is the most natural way to obtain vitamin D. However, the amount needed varies depending on factors like time of day, season, and skin pigmentation. It's important to balance sun exposure benefits with skin cancer risks. Dietary sources are limited, but incorporating vitamin D-rich foods can help. For those at risk of deficiency, supplementation may be necessary. By prioritizing vitamin D intake, individuals can maintain optimal levels and support overall health. Regular monitoring through blood tests can help ensure adequate intake and prevent deficiency.